basically came up with this idea as we were driving over here to the studio. To service or not to service, Dr. David Ye, tell us about service from an industry standpoint.
I've been in this field for a long time.
Can you tell us how long?
I've been working as a neurosurgeon in private practice for the last 18 years. I had 7 years of training beforehand, so that's 25 years of my life. And so I've been dealing with a lot of different products, people, sales rep. I've worked with a lot of different people. And the bottom line is, any company, anyone can make a screw, anyone can bring the product to me to use, but that's not what service is. Service is when something goes wrong or when I need something right away, and it's there for me, and you guys can fix the problem. Okay. And most companies, they say they provide a service, but they don't. They provide a rep and they provide a product, but they don't provide a service.
When you're looking at service, or like when somebody hears that in the surgery space, like, what does that mean to you? What does ideal service look to you?
Good evening, everyone. Reporting live from Radiant Pictures. Radiance or Radiant?
I think
it doesn't matter. Thomas Cook is the owner here. It's Milpitas, California. It's another episode of Death of a Spine Salesman. We have a great guest, y'all. Dr. David Ye is here. The man, the myth, he's legendary. And let me just say, the topic is, it came from William Shakespeare. To service or not to service? That is the question. And people want to know what the heck we're talking about. So, Jonathan, what does it mean to service or not to service?
Man, I mean, when you hear that, you automatically think, service, you think about, customer service, you think about serving in like a restaurant setting service. You just want to be able to provide a service to somebody at the best level. And then not to service, you're just like, not to service, if you're in that industry, you're in that space, that's what you got to do, right?
We are in the industry of service.
Yeah, right.
Which is perfect to introduce our guest because he's coming in hot. We basically came up with this idea as we were driving over here to the studio. To service or not to service, Dr. David Ye, tell us about service from an industry standpoint.
Well, when we're doing our surgery, we're so focused, involved in what we're doing because everything's so delicate, everything's so exact and precise. We don't have time to really focus on other stuff. When we want an equipment, we want this tool, we expect it to be there, and we expect it to be working well. And so we don't have to think about it. And that's what customer service is for. That's what it means to me.
Yeah.
And I've been in this field for a long time.
Can you tell us how long?
I've been working as a neurosurgeon in private practice for the last 18 years. I had 7 years of training beforehand, so that's 25 years of my life. And so I've been dealing with a lot of different products, people, sales rep, engineer. I've worked with a lot of different people.
Yeah.
And the bottom line is, any company, anyone can make a screw, anyone can bring the product to me to use. But that's not what service is. Service is when something goes wrong or when I need something right away, and it's there for me, and you guys can fix the problem. Okay. And most companies, they say they provide a service, but they don't. They provide a rep and they provide a product, but they don't provide a service. So
and I mean, to go off of that real quick, I mean, like, for everybody who knows, like, neurosurgeon, we're in the spine industry, right? So when you're hearing service, at least for me initially, you don't really think like surgery, neurosurgery, any sort of surgery. You're thinking service, And when I hear that, it's like service. What are you meaning by that? So like jumping into that and kind of just like, let's start from like a little earlier of just like, when you're looking at service, or like when somebody hears that in the surgery space, like, what does that mean to you? What does ideal service look to you?
Well, ideal service is when I have everything for me all the time, right away, whenever I need it, and that, when you should be able to anticipate things that may go wrong and have solutions for it right away. So I don't have to be delayed. I don't have to worry about, things that, that's, beyond my control in terms of the equipment.
Right.
Yep.
Right.
Yep. It is not too much to ask, right? And this is what I preach and beat people up on. And I'm sick of beating reps up, but give a shit.
Right.
Give a freaking shit. This gentleman is coming in, and he has a job to do. And he's bringing nothing but his A game and his passion and all those years of schooling and all the freaking instinctual stuff that he's learned throughout the way. And he is going to go to work. So, everyone in that room, look, we have circulators, we have scrub techs, they punch a time clock, right?
Yeah.
They are going to be there for a certain time, and we are lucky because we have one of the best crew. We have a consistent crew, which I think is extremely important. But at the end of the day, they're going to get braked. I love how the hospitals have this designated break right as we're instrumenting. Why is it always a time we are
It really
instrumenting?
does.
I just
It
go
goes at the worst.
Look, I know he's going, oh shit, because we are going, oh.
Oh man.
Yeah.
Even some of the scrubs are like, you know what? I'm just gonna wait. I'm just gonna wait because we need to
And
get this
that's what's
done.
nice about my team, because
Yeah.
they do wait. And
They
wait
do
until
wait.
No,
there's
yeah.
actually a pause or like a slowdown or
Yeah.
safe period for them to leave.
Yep.
So that's what I like about my team.
Absolutely.
But that's not what we're talking about today. We're talking about the service.
No, we're talking about the service component but what I'm saying is if the representative who's going into the case, right? First of all, they're pretty blessed to go into that case.
100%.
They must be talented, because if you're going in his room, you have been dubbed good enough to come into that room. Now let's take it further. You need to know a surgical workflow. And it doesn't mean just instrumentation. So what I interpret what you're saying is no skin to skin.
Yep.
We make detailed notes, Dr. Yang, of what you like, from your hemostasis product to your nerve hook to your kerosins. We know when we get the gold tip, better get ready, another one. Like, what are the other instruments that, like, he needs, and we have to check before he even comes into the room.
The cranial posterior cervical's got to have his craniotome in there for
Yeah.
his being able to sit down
To
properly.
take that
because there's
freaking
certain
lobster
attachments
tail
that
out.
he needs. Yep, absolutely. Being
Yeah.
able to know that he likes the blade or he likes to drill on the left, and then he likes the bogey on the right.
And it's more than just that. It's, you're anticipating my next step and my needs
100
in
times
case
over.
something happens.
Yeah.
100%.
And a lot of reps come in, all of service reps that come in, they don't do that. They just bring the screw in, they just bring my instrument, but they don't know what I need next. They don't know what happens if this doesn't work. What are the options I have?
Right.
And so, that's what we're missing in a lot of these companies
Yeah.
to provide quote unquote service.
Yeah.
Because we talked about it in the car, right? Like, the larger med tech companies, and I don't need to name them, you guys all know what I'm talking about. They think if they bundle up technologies and shop it to the hospital systems, the administrators are going to say, oh, this is the lower price. They're branding everything. They're giving us all this stuff. It's a freaking play, because I'm going to give you a lackluster sales representative that truly I'm paying a salary, and they don't really give us shit. They don't.
They don't.
And it's dying, Dr. Ye.
I mean, they can come in. For instance, the case that you're kind of referring to today, I had to do a brain biopsy, and I was, the rep came in and knew how to use the system, but something went wrong, and she wasn't able to troubleshoot it. She had to go on the phone, call someone up, and spend, a lot of time trying to troubleshoot this whole thing and figure out how to make this thing work. Right. At the end, she couldn't do it, and we had to cancel the surgery.
Oh my gosh! And this patient, because I've been dealing a lot with my parents' surgeries, right?
Right.
So now I saw the whole thing of getting there super early. You had to delay your case from 7 a.m. start to the afternoon, waiting on the company representative. That piece of equipment was $1 million plus.
Yeah.
You have to change your entire schedule, and the patient suffers.
Right, and that's the thing that, I mean, when you're a representative, you're thinking about, oh, I just need to show with my instruments and make sure that they're sterile. It's so much more than
So
that,
much
and you gotta think outside of the box. You've got to think more broad picture. You've got to think customer service to the fullest extent, and that's what you've preached to me, and that's what the people that you surround me with are just like. It goes way beyond just bringing instruments and bringing sets into a room and making sure they're sterile, ready to go.
Yeah. Well, good. Like, let me lead into this because there's a commonality between us three sitting in here. Where did you grow up?
I grew up in San Jose, California.
Where did you grow up?
Grew up in San Jose, California.
You could say Morgan Hill, but that's
But I grew up in Morgan Hill.
Love.
Yeah, grew up in Morgan Hill, but went to school all in San Jose, California.
San Jose, California, born and raised, is where the playground I spent most of my days. I just made that up. Don't use it, anyone. That's Fresh Prince. But,
yeah, right.
Okay, so we have an attachment to this community.
Yep.
Right.
You went to Oak Grove.
This is my community, my world.
Yeah.
The people around here are part of my life. So.
How many times do you get recognized when you go to like a Costco? I love when those stories happen.
Too much.
You're like, dude, he's like, do you mask it up? Do you like wear a hoodie?
No.
Right. Do the baseball cap,
paparazzi be coming
glasses,
out?
all
I
that.
don't
Yeah.
do that.
No.
I'm not famous. I just, just
You are
people
freaking
recognize
famous.
me.
Yeah.
You
Well,
changed
and that's
lives.
And I appreciate that. So
Yeah,
100%.
and we appreciate that, having the access to you, because a ton of my friends, family, I know if you need, a brain, God forbid, a brain or a spine that needs to happen, it's going to happen. I know where to go.
Right.
Oh,
Hands down.
Thank you.
Hands down. Well, look, I mean, how many months ago did you, maybe a month ago now, my dad's post-op from you?
Got to be just about.
That was a crazy story. We'll save it for another time, or maybe we go into it. But my point of this is talking about community.
Right.
And the representative, and he's in agreement, is part of the surgical team.
Yep.
And the circulator, the scrub tech, the anesthesiologist, all about the surgical team. I mean, go even further, the x-ray tech, either they can make or break your case. Shout out Yvette. We know you're number one.
Yes.
Yvette, we love you. So we have an obligation as a representative, especially in the fact that we live in San Jose.
Right.
And I think about that as I do my job. And I know you do, so why can't that carry on over to me? You instilled that in me at a very long time ago when I started working with you, and it never leaves me. And like, what I'm trying to do is pass it to the fucking youth. Sorry, F-bomb, but you know what? I get passionate about it. But I want people to know out there, you got to pay it forward. You got to pay it forward. He gives it to me. I give it to you. That's a freaking power.
Right.
And this community is very important to us because we're not going to leave.
Nope.
We're not going to leave. There ain't no better place than this.
Yeah.
Remember when I tried Sacramento? I was like, get me the heck out of here.
What was the Leonardo line in Wolf on Wall Street? I'm not fucking leaving.
That's what we got to do here.
That's it.
Look,
That's it.
I mean, I'm so excited I get him on here.
Right.
I never thought in a million years. I'm not going to lie.
Yeah.
I'm not gonna lie.
This relationship runs deep, man. So to see,
I mean, he's a groomsman in my wedding that I just had. We're gonna show you
Exactly.
guys pictures of it. I mean, I made them wear
My turban.
the turban and the red dragon blazer.
Oh, the red dragon. Well, dude, honestly, on Amazon, and you guys will see the pictures on Amazon.
Man,
It
awesome.
looked like those were floral prints. And then like Jim's like, dude, these are freaking dragons. I'm like, that's even hotter.
Red dragon
but they
blazer
look so
tops.
good.
No, they look great.
They look good.
It all collectively flowed and worked together.
Yeah.
It just it all worked.
Well,
It really did.
okay, let's go back. Let's go back to service. Let's go back to service, and how do we make it better, Dr. Ye, for other representatives, because it's only getting worse.
You need to understand the surgeon. You need to understand the surgeon's workflow, and you need to understand surgery. You really need to know the surgery, okay? Because if you don't understand surgery, know the surgery, you don't know what's next or what they're gonna use. Okay, so and that's something you know. You guys know because I work with you guys. You guys know. I mean, honestly, I bet you guys can do that surgery.
I tried in a cadaver lab. I tried to do a T-lift in a cadaver lab, and I inserted the cage into the freaking abdomen.
But at least you guys know
Yeah.
what steps are next and what to do next.
Sure.
And so when I'm done with this part, you know what I need next. You know before you know that I need this cage. You know, and you guys look at the MRIs, the images before.
Yeah.
You guys already know what
Yeah.
size instruments I need, what size screws I need, what size expandable cage rods. I mean, you guys do all that measurement beforehand.
Because we give a shit.
So I don't have to think about it.
I know.
Okay. I mean, I just stick my hand out and the stuff is there.
Yeah.
And it's very nice. It's not just that part of it. It's your availability because I take call a lot. Every third night, and you never know. Sometimes 2 o'clock in the morning, I have to do an emergency surgery. I give you guys a call. You guys are there.